there's going to be a very different immunological landscape by this time next year. Looking out on with the longer term, I think there will come a point at which COVID will become something that people like me are concerned about and we continue to track in the same way that we continue to track other diseases like influenza, tuberculosis, and so on and so forth, but which most people don't pay as much attention to. But that's, and we are so much closer to that point than we were, but we're not actually there yet. I think that we have to look back at where we've come, at how far we've come and how great it is, while at the same time recognizing that for the unvaccinated communities in particular, and there's a lot of people in the global south like we were hearing just now, who are not vaccinated. We have to recognize that from a global point of view, we are still absolutely in the thick of this.
Hello, welcome to Cambridge Forum, coming to you live via Zoom. I'm Mary Stack, the Executive Director, and today we're considering how well the world handled the first wave of the pandemic. Today, as the highly transmissible Delta variant spreads across the country in a third wave, and the stock market continues to struggle with more bad news, we see more clearly than ever how the COVID-19 pandemic has emerged as the biggest global public health challenge in history. Just when we thought we had some things under control and governments were tentatively opening up, we now find ourselves in a pandemic of the unvaccinated, according to the CDC Director, Rochelle Walensky. But before we get to all that, let me start by introducing today's erudite guests. Peter Baldwin is a professor of comparative history at UCLA, author of several books, including Contagion and the State in Europe, 1830 to 1930, and Disease and Democracy, The Industrialized World Faces AIDS. His latest book is Fighting the First Wave, How the Coronavirus was Tackled Differently Around the Globe. Our second guest is Professor Bill Hanage, an epidemiologist at Harvard's Chan School of Public Health, where he's a faculty member at the Center for Communicable Disease Dynamics. Welcome to you both. Thanks for making the time to join us. Well, let's start with you, Peter. It is worth remembering the statistics attached to two of the well-known plagues in history. I think the Black Death caused 200 million deaths in 4 years, and the 1918 influenza epidemic in 1918 infected 500 million and killed 50 million worldwide. Meanwhile, COVID has infected a reported 192 million, with 4.2 million deaths to date. In context, then, how has this SARS-CoV-19 pandemic different from other historical pandemics that you've studied? And how is our perception of it different? Is it just that we're more accessed to global information?
Well, when you put it that way, we should count our blessings, right? We're quite lucky in that sense. This is a disease that, compared to what we've been through in the past, whether we're talking plague or Ebola or MERS or SARS, is much less lethal. It's about the same lethality, same case fatality rate as the 1918 influenza. But on the other hand, it moves really quickly, and that's not just because of the sort of enhanced transportation infrastructure of the world. It's also because it's an airborne disease. You have to breathe on somebody else. You don't really have to interact with them any more than that. And of course, a lot of the people who have it don't know that they have it, or they're asymptomatic, and so they don't go home, crawl into their beds and stay there. They're out and about. Indeed, if the headlines would tell you anything, they're out and about clubbing these days. And so that, of course, also helps spread it. And that explains partly why it is that it went around the world in a matter of weeks, really in a way that other pandemics ground their way out over months and years. So it's very different. It's much more sort of on our radar, obviously, which has to do with our ability to know what's going on elsewhere in the world too. Those are all platitudes, but clearly it could have been much, much worse.
But I wondered, from the scare factor, what I tried to do by talking about those statistics was to put it into historical context, which is your specialty, how we're affected by it and how much greater people suffered globally in the past with these things. Partly it's because we know it's going on. right? So we can scare ourselves into these kind of panic modes. Yes, it's good in terms of translating, informing people and getting people to shut down, vaccinate, distance. But I just wondered, is it as bad as we think it is?
It's certainly it's the worst thing that's happened to us in these terms since 1918, in terms by which I mean an epidemic that sort of hits us quickly and evidently. I mean, in terms of overall deaths, HIV has killed many more people so far over the last 20, 30 years. So if you're looking at it from that point of view, we're not anywhere near that yet. So in that sense, what you say is right. But this is something that we have been scared into thinking about, and rightly so.
That's interesting, because when I was studying these epidemics, I didn't think to look at the AIDS numbers because it's a quieter, more stealthy kind of death rate. So what is the kind of total, do you think?
Oh, that's above my pay grade, but I'm guessing so.
Well,
deep into double figure millions, I think.
Goodness.
Bill is the expert. If you nod.
Yeah, I would say a figure that I was bandying around a few years ago would have been about 40 million, but there's obviously a certain amount of uncertainty depending on how you count the numbers.
Right.
So let's go back to 18 months ago now. So it's January 2020. This new coronavirus has unleashed itself on the world. There's pandemonium everywhere. 200 countries are facing the same challenge, but they responded in quite startlingly different ways. So you argue in your book that the pandemic was a problem in geoepidemiology. Each country was battling the virus with wildly varied resources. And you talked about those. You said there was the individual country's experience with disease, there was the quality of its healthcare, the equality of its society, and lastly, the historic relationship between the governors and the governed. Can you explain a little bit of what you meant by this?
Well, keep firmly in mind that during the first year, we are dealing strictly with a public health issue. There's no medical solution, there's no vaccination, there's no cure, nothing like that. Everything changes in December, January of this year, January of this year. When we get the vaccines, it's a totally different ballgame. But in the first year or so of the pandemic, all we had to work with were public health measures of the sort that effectively we've been using since biblical times: quarantine, isolation, shutting down travel, keeping people from each other, that sort of thing. Now, I suppose it's fair to say that the disease was, of course, the same everywhere in the world, but the epidemic wasn't in the beginning. In the beginning, it hit different places quite differently. Some places were islands and managed to actually shut themselves down and to stay out of the fray for a while. New Zealand, Australia, Iceland, places like that. In the beginning, there was even talk about sort of biological differences. The Buddhist Triangle in Southeast Asia was surprisingly unhit. People wondered why that was. It's not that long ago that Indian journalists wrote in the New Yorker and places like that one of the reasons for why India had such a low rate was that Indians had robust immune systems compared to Westerners, because they were used to putting up with the insults of an unsanitary everyday environment. We hear a lot less about that these days. The playing field has sort of been leveled in that sense. So for the first many months, it was sort of a different pandemic in different places, and that helps explain part of the difference in the response. The reason why they weren't taking it very seriously in the Dakotas compared to the coasts in this country had a lot to do with the fact that there were more cases and people were more worried about it, and the places where it took longer to get, they were insouciant for longer. So different pandemic for a while, but in a sense, the variants have now leveled that playing field, and we see that the variants are sort of going in where it was untouched, or at least not terribly ravaged ground before. So the pandemic experience from a public health point of view has been different for the first year of the pandemic. If you want to think about the the public health response and why that has differed, that's of course a whole other set of questions. And in the book, I sort of try to outline the broad scope of the differences in response. The Asian countries did comparatively well. I include here New Zealand and Australia as honorary Asian countries, but geographically they're obviously that. And certainly the way that they behaved vis-a-vis the pandemic, they were Asian in that sense too. These countries sort of recognized it quite quickly, clamped down, locked down, shut down intercourse insofar as it needed to be. And if they didn't do that, they controlled and tested their population so that they could isolate those who were ill and therefore prevent any further spread. And they did sort of quite well throughout the first year of the pandemic. Then, of course, there's the rest of us, as it were, those nations who didn't pay attention early enough, who didn't shut down travel early enough, for whom suddenly it was a matter of waking up and discovering that the pandemic was not only present, but had spread much further than we thought already, and for whom there wasn't really much else to do but a kind of post hoc lockdown in hopes of squashing it after the fact. And then finally, there were a couple of countries that decided to sort of be much more enthusiastic about it. Some of them hitched their fortunes to the wagon of herd immunity, thinking that there was actually an advantage in letting the disease wash through the population. No politician really admitted that, but some of them seem to have acted on that assumption. And among the oddest of these countries is perhaps Sweden, where they decided there was really no reason to tell the Swedes what to do because they knew perfectly well what to do on their own, and they would do the right thing. And yet at the same time, they also welcomed herd immunity. So clearly the Swedes were out about doing things they shouldn't have been doing, because otherwise you wouldn't have gotten herd immunity. So, there were a variety of approaches that were taken, some of them sort of forced upon nations and some of them voluntarily chosen. The Swedes didn't have to do what they did. The Belgians probably didn't have much of a choice once they discovered they had been infected.
You mentioned this competence and compliance being very connected in terms of who did what when and how things worked or didn't work. And you mentioned some of them. So what about leadership? I mean, Trump and Bolsonaro were both kind of fairly chaotic, what word can we use? Populist leaders in this regard, or non-leaders actually. And so that led to a lot of confusion, particularly in a country like the States, where we've got so many autonomous states doing their own thing. So partly, I think there was a big disconnect between like the CDC and the federal government and individual state health authorities. So in some ways, I wonder how accurate, and this brings me to China, where everything started. How accurate do you think the actual statistics are about deaths, etc.? I looked up the other day and it had some silly amount, like 5,000 people had died in China. Can't possibly be true. I mean, so are we getting an accurate view of what's going on when we're kind of reliant on people volunteering some of this information?
I have no particular opinion about the quality of the Chinese statistics. I'm sure that your broad point is right, that not all statistics are equally good. I went in and had a look at the Indian statistics today. If you believe the Indian figures, they still have a mortality rate that is about the same level as the mortality rate per capita as Denmark. That seems perhaps a bit unlikely, but who knows? But I think, sort of broadly speaking, it is certainly the case the Chinese were not hit anywhere nearly as hard as others by virtue of clamping down. And even if they did more poorly than they would like to present themselves as having done, I think we have a pretty transparent view of what went on in South Korea and Taiwan and other places in that part of the world that also did extremely well. So,
but I think in some ways they learned from direct contact with the SARS epidemic. I mean, they were prepared. That part of the world was already prepared, more prepared than anybody else, it seemed.
Yes, these nations knew more of what they were dealing with and were better prepared to sort of clamp down. They had a lot of the infrastructure ready to go in a population that sort of understood that it really isn't all that bad a thing if your government is, tracking your movements using your bank accounts and your credit card statements and all that sort of thing, and are not going to kick up a fuss about it.
Mm.
You know, the extraordinary thing in the democracies is, why did we Western industrialized democracies do so poorly? And part of that has to have to do with the fact that we played up the civil liberties aspect. I mean, why did we get into huge fights over things like masks and tracing apps in the middle of the worst pandemic of a century? I have yet to hear a reasonable explanation of what civil right precisely it is that masks violate, or the obligation to wear them violate. I mean, it's a clue to me what it is that's being taken from people. And the idea that privacy and the ability of the authorities to find out where you've been and whether you've been in proximity to somebody who's been infected, that somehow violates a right that is more important in the midst of a pandemic than the ability to track and trace, is also obscure to me. But these are the kinds of battles that, you know, we spent an inordinate amount of time fighting about when we possibly had better things to think about.
This is probably a little bit hard to gauge, but having a change of administration where we feel, you know, most of us, that somebody's actually running the show now and it's in control and has actually immediately put measures into place to try and deal with this on a very large scale. Is it hard because that trust thing that you're talking about, that contract between compliance and competence, was already kind of marred for many people by the first 12 months or so of having someone not running any kind of program in terms of vaccination or protection? I mean, it was just very much, we were very late to the game. So how much does that damage public trust, really?
Hugely, would be my guess. On the other hand, I think in some ways, you know, public leaders in the democracies wildly underestimated the extent to which their populations actually wanted them to be decisive and to make them feel secure. You know, we see that in quite clearly in the UK, where the Boris Johnson's government, you know, waving his Tory libertarian flag, said, "Oh no, you know, the average Brit doesn't want to be locked down, doesn't want to be deprived of the liberty to go to the pub and all that sort of thing." And yet, you know, public opinion polls revealed that the average Brit was perfectly happy to sit home and as long as they could feel secure. And you know, even today, Freedom Day, Liberty Day, whatever they call it was yesterday, the 19th, right, or 2 days ago, whenever it was, the Brits were supposedly released. The Guardian or the FT, I've forgotten which one it was, you know, described central London this morning as, you know, looking more like Seville in August, you know, because everyone, with again a few exceptions, sort of the 20-year-olds going out clubbing, nobody's sort of rushing off to restaurants and to sit inside because they know perfectly well that it's not a sensible thing to do. So I think that this idea that some people were, you know, chomping at the bit of their liberties is wildly exaggerated.
Well, we're going to come to Bill in a moment on that, because he actually has just come back from London like 24 hours ago. So I'd be interested to see what his observations were on that. But just one thing that you said in the book that I thought was quite interesting. You said many humanities student had cause to reflect on the complexity and fragility of modern society's supply chains. Others became aware not only of the existence, but also the eminent dignity of the invisible people who made their lives possible. So being idealistic here for a moment, do you think we learned any lessons, any good lessons on that, or are they very temporary lessons?
Well, you're quoting me quoting someone, and the someone I'm quoting is B.H. Bernard-Henri Lévy, you know, as a classic champagne socialist. I thought it was slightly ironic that suddenly he would discover the trials and tribulations of the common man during his lockdown. But I think he was actually, you know, unwittingly speaking for many of us who might not be as frank and willing to admit it as was he, which is that not all of us realized what it takes to keep our lives functioning until suddenly we can't go outside. And we realize what exactly is involved in putting food on the shelves in the grocery stores and delivering the mail and getting the Amazon packages there and keeping, you know, your pool filters cleaned and whatever else goes into your average middle and upper middle class life. So one of the great divides, not that it comes as a huge revelation to us, we knew it all along, but we don't talk about it. One of the great divides within the industrialized world was, of course, between those who had to go out and work to keep those of us who stayed at home happy in our self-imposed exiles. So that is one of the great social divides that we became painfully aware of. Clapping for the NHS doctors, we should equally have been clapping for the trash men. We should have been basically spending our days clapping for everyone. And then, of course, the other divide that now is becoming increasingly evident is that between the vaccinated first world and the still unvaccinated global south, which is, being ravaged in a way that is not yet the case in the first world by yet another wave, and a wave that is worse because it's the variants with their higher transmissibility and whatever else may be involved there.
Well, I do think one little note of hope is that I see that a lot of service workers haven't rushed back to their jobs. In fact, they're having a lot of trouble in Massachusetts getting waiters and bartenders and what have you back to work. So I think it's actually pushed their wages up, which yes. I think is great.
Well, if I may make a point on this respect about the public health response in this country, and in the UK it's largely the same, was pretty catastrophic. There's no question about that. And a lot of that is owed to our presidential leadership or its lack. On the other hand, having said that, there are two things that the Trump administration did get right. And one of them was just pour a ton of money into keeping the economy afloat. I mean, who knew that America had a welfare state of that sort? But improvisedly, we did. And the other was pour a ton of money into getting vaccines as quickly as you possibly can. And there he was right too. The UK and the US made a hash of the public health response. They were brilliant when it came to the vaccine response. Lots of other countries, it's in effect the reverse. I mean, if you look at Australia and New Zealand right now, that did brilliantly during the public health response and then sat on their hands.
Yeah. And Canada did too.
Waiting for what? I mean, why were they not sort of importing vaccines up the wazoo and getting their population vaccinated? And now they're sort of sitting there saying, what, me? And, why should we get vaccinated? Things are fine here. And so, they're now virgin territory for sort of new variants to sort of come and eat them. And it's a weird reversal of fortune that having played their hand so well the first time, they then end up misplaying it in the long run.
Well, it couldn't possibly sustain just doing the isolation thing. It was very short-term thinking, really, wasn't it?
Well, but it was the only thing that could be done at the moment. I mean, it was a holding pattern. I think we all understand that public health response wasn't a permanent solution unless we had somehow locked down the entire globe everywhere. If everybody had just stayed home for 3 weeks and somehow managed to, not die of starvation, we would have been in the same position as we were the day before patient zero. But that's obviously logistically not going to work. And so given that, obviously the public health response is only a holding pattern until, ideally, some kind of medical vaccine solution arrives and allows us out of it. And that's where Australia and New Zealand ended up flubbing it, not sort of being prepared for that next step.
So ironic, because the guy that actually gave the genome sequencing to the world was Australian, if I remember correctly. He was working with a guy in China, but anyway, that's another matter. Okay, so they were somehow writing this book almost concurrently with this story emerging, which is kind of a difficult thing to do. So when your book came out in April, Peter, is there any way that you could have envisaged that we'd now be on the third wave of this thing? I mean, most doctors probably didn't anticipate it, or maybe they the last billion.
I think everybody anticipated it because without a vaccine, there was going to be sort of series of further waves. Who knows how many? So I don't think there's any sort of big mystery about there being another wave. What's happened since the book came out? There are two big things. One is the vaccines, and the other is the variants, and they sort of go hand in hand. The vaccines change the game radically. They give us the possibility, but only the possibility of getting out of it. On the other hand, the variants, as more people get it and are not vaccinated yet, the variants, of course, multiply. And depending on what the variants do, it's sort of a race now between the vaccines and the variants. So the public health response was just, the first step. Now comes the serious step of actually sort of exiting from the pandemic. And whether and how we do that that's an ongoing story. The hope, of course, is that this third wave is going to be less dangerous than the first two waves because of the effect of the vaccine. But that's a question of whether we get the vaccination done before further variants come.
Well, now's the perfect time to switch to Bill Hanage, who's an epidemiologist at Harvard's Jones Public Health School. He's also a faculty member at the Center for Communicable Disease Dynamics. So Bill, welcome. You just arrived or returned from the UK this week. And yesterday, Boris Johnson removed many of the social restraints that have been there for months and months. Was this a bit premature in your opinion? And how did you behave when you were there?
Those are both good questions. I think the thing you got to remember when you think about the UK is that it's not exactly been under the most stringent of restrictions for quite some time. And there's been exponential growth of Delta happening since April. So the final, when you're talking about the final sort of Freedom Day, to give it the title which it was bestowed upon it by the right-wing press, to focus on that to the exclusion of what happened before is a mistake in my view. What does happen about Freedom Day is that it allows large groupings of people to get together. We were talking about nightclubs just now, and that's going to be particularly anxiety inducing because it looks like Delta has a very strong capacity for super spreading. And so over the last few months, you have been able to see the exponential growth being driven by younger age groups, the 20-somethings, and indeed adolescents. Schools were open, high schools were open, mask mandates were withdrawn on the 17th of May. This all went together into producing a situation where there are daily case counts in the UK at the moment rivaling the highest that they have ever been. Now, this is not producing a huge catastrophe in the National Health Service, but it is producing strain already. And we can expect there to be more strain because cases have been increasing very rapidly the last few weeks, and it's too early for those to really be rocking into healthcare. So it is premature. It would have been much better, in my view, to have waited a bit longer so you could have vaccinated those younger age groups. I also think it would be better to have apportioned some vaccine doses to those younger age groups earlier in order to get the indirect benefit of limiting transmission. However, it is a situation as it is, and hopefully we're going to be able to look at it and learn something from it.
So when you were there, how comfortable did you feel knowing what you know, moving around? Did you feel that you wanted to wear a mask?
Oh, yes. I didn't wear a mask outside. I still think that, and I met a friend and we sat in the middle of Blackheath with a couple of tinnies and the stiff breeze blowing between us. But when I went indoors into public spaces, yes, I wore a mask at all times, not least because of the fact that I knew I was due to be traveling back to the United States and I didn't want my travel plans to be disrupted because I am double vaccinated. I've got 2 mRNA shots. And so I am protected from the worst consequences of infection, even with Delta. On the other hand, I'm not keen to contribute to Delta spread, and the daily incidence in the UK is really very high at the moment. So I think that we need to think carefully about how we handle these things. It's very interesting, Mary, to contrast the United Kingdom with Israel, which is another country with high rates of immunization, but which put an indoor mask mandate in place very rapidly as Delta started to take off, and then concentrated on vaccinating younger age groups. At the moment, the situation there is more under control than it is in the UK. And in general, Israel has had a far better pandemic. In fact, if the per capita mortality in Israel were applied to the United Kingdom, up to now, there'd be about 80,000 people there still alive. So you can actually, over this point, you can see the consequences of making those bad decisions.
Gosh, that's an expensive decision. Somebody at the top to have to live with, isn't it? Going back now to how this particular virus is, or pandemic attached to this virus, is different from others that we've known historically. I think it's quite interesting. You know what makes it a fairly unique kind of pandemic. And one of the things you were saying, which I didn't realize and I didn't really think about, was something like Ebola can be transmitted, but you know you have it. It's clear that you have it.
Yeah.
And the big thing about this, particularly this Delta variant, because it is young people walking around carrying it, and And some of them are vaccinated. My daughter has it and she was fully vaccinated. So there are breakthrough infections. But how is this different? Is it largely the fantastically fast speed, the speed of the transmissibility is now so much faster than the original COVID, in conjunction with the fact that you don't know you have it?
Well, people right from the start of it didn't know they necessarily had it. That's the most crucial thing in whether or not an infectious disease is controllable. If people can be transmitting it unwittingly, then it becomes very hard to deal with. The big difference between SARS-CoV-2 and SARS-CoV-1 was that SARS-CoV-1 transmitted from people once they developed symptoms. So it was comparatively easy to, put on a mask to stay away from people who are coughing and spluttering. It becomes much harder when any substantial fraction of transmission happens from people who are either pre-symptomatic or with very mild symptoms, who transmit it without knowing. And a significant fraction of people infected with SARS-CoV-2, even Delta, don't have particularly severe symptoms, but they can transmit it. I mean, this is one thing that we have to recall. SARS-CoV-2 and COVID, the disease that results from it, are in a position where it's very hard to control. And I think Peter probably knows more than I do about the way that governments have responded to this. But it's hard to persuade people to take strong action to prevent infections with something which can appear mild, but which, when thousands of people, when millions of people all become infected with it at the same time, will pose very severe damage to healthcare systems and have very, very significant mortality. Now, nobody should be under any illusions about what this virus can do now. And yet, the majority of people who get infected with it will be fine. And those two things can both be true. And it's quite hard to communicate that.
You said in an interview on The World, the emergence of Delta is catastrophic. In the knowledge that 97% of those who are currently hospitalized are unvaccinated, how worried should the rest of us be? And should we be rethinking our behavior in light of this?
That's a great question. And I think it's very important to note that the vaccines, the mRNA vaccines in particular, but even the maligned Oxford AstraZeneca one, do provide very good protection indeed against hospitalization and death. They don't stop all breakthrough disease, as you know. However, they do have a really, really good public health impact. When I said it was catastrophic, I was thinking as much of the fact that once you have something which can be highly transmissible, which transmits really quickly, which is another thing about Delta, you have this problem that this is an epidemiologist's nightmare, because it's a highly transmissible virus which will get into people before we can vaccinate them. And that means that we're going to have a far more worrying next few months than we would have had, if we were dealing with the old Alpha variant, or even more so the founder virus before then. So when I say it's catastrophic, I'm not so much thinking about the United States, although there are a few counties down there in the South that really could stand to up their vaccination rates. It was more about the rest of the world. Those of us who are vaccinated, if you don't want to contribute to Delta spread, consider wearing a mask indoors, try and avoid going to crowded areas, in particular where you don't know the vaccine status of people, and keep an eye on what's happening locally.
Okay, what about these variants and the science? I know you're very, very good, because we had Sharon Peacock on a couple of weeks ago talking about that they can identify the worrisome, or what is it, your VOCs, variants of interest?
Variants of concern. There's variants under investigation, variants of interest, variants of concern, and then there's also the CDC has variants of high consequence. And at present, there aren't any in that category.
Oh, that's good.
But the closest to it is Delta.
So right now, apparently everything is working in defense, the vaccines that we have, but two questions. I mean, obviously that might change, and we might have to have a booster at some point, I imagine. The second thing is, how good will the test remain? Will it stay good regardless of the number of different variants?
So
the antibodies change or no?
Well, it depends on there are lots of different tests that you can use. The ones that we mostly hear about these days are these PCR tests, which detect the presence of specific sequences, specific bits of the viral genome. And even though to an extent which is kind of ridiculous, the tests in use vary a lot, they typically look at multiple different sites in the genome. So even if one of them doesn't work anymore, the others should give a reliable signal. That's actually one of the ways in which we were first able to see how bad Delta was. Because in the UK, where, as we know, Alpha had been very prominent and where Alpha initially emerged, there was a mutation in that variant, which meant that one of these tests to detect the presence of the viral RNA didn't work. The other two did, so you'd get these things which were called spike gene target failures, meaning that you couldn't see the spike. You could see the other genes, but not the spike. And in April, you could start seeing that the proportion of tests that were spike gene target failures was dropping very quickly. And that was one of the first signs we had that Delta was really starting to take off there, because Delta gives a slightly different test result. I think that we're okay with tests going forward. But it's still, if you're an epidemiology nerd, is worth watching them closely to see what happens.
So going forward now, I mean, we've talked about these two populations, which we know. So we've got this kind of pandemic of the unvaccinated, which is a big problem if we can't get to these people and explain to them why they need to be vaccinated. But the other thing is this just something that, I don't know, you said this time next year, maybe I've got this wrong, but I think you said this time next year, everyone in the US will either have had the vaccination or been exposed to the disease.
Yeah, it seems fairly likely, not only in the US, because Delta is so highly transmissible. And we haven't even, it's a summer at the moment, and we haven't got to the period where respiratory virus season, as we call it, when you'd expect transmission to be picking up again. So there's going to be a very different immunological landscape by this time next year. Looking out with the longer term, I think there will come a point at which COVID will become something that people like me are concerned about, and we continue to track in the same way that we continue to track other diseases like influenza, tuberculosis, and so on and so forth, but which most people don't pay as much attention to. But we are so much closer to that point than we were, but we're not actually there yet. I think that we have to look back at where we've come, at how far we've come and how great it is, while at the same time recognizing that for the unvaccinated communities in particular, and there's a lot of people in the global south like we were hearing just now, who are not vaccinated. We have to recognize that from a global point of view, we are still absolutely in the thick of this.
Do you think it will ever become something that you get along with your childhood vaccinations, your MMRs, and it'll be just another? The
vaccines. Well, this is a question which is which is kind of difficult to answer, which actually goes to the very heart of one of the hot button issues that there are at the moment, which is, to what extent should you vaccinate children? Most discussion about children is, I have to say, sadly, profoundly ill-informed. Children are not, from the point of view of the virus, is not everybody under the age of 18. It is the case that the very youngest kids are very unlikely to have severe symptoms. Not impossible, but very unlikely. This is the age group in which it may even be true that flu is worse, because flu tends to exert its most severe effects at the extremes of age. But once you get over 5 and you're getting closer to 10, to say nothing of whatever variants are doing to kids, then things start to change. And once you get into the teenagers, well, the teenagers are among those groups who have been most involved in transmitting viruses over the course of the pandemic. Again, they're really unlikely to have severe illness, but they are not, but it's rare, but it's not impossible, and they can infect others. So when you're thinking about this, you have to bear that in mind. I have a suspicion that we may, in a very highly vaccinated community, hope that younger kids get their first exposure to SARS-CoV-2 naturally. And then when they come back, the very youngest kids, I want to say here, then when they become reinfected, they'll build up immunity in the way that arguably has happened with coronaviruses beforehand. But at the moment, you've got to remember that we've still got a lot of virus around there. I mean, you probably heard apocryphally, at least, of the concept of chickenpox parties, you know?
No, but that came to mind as soon as you said just get exposed naturally, because that's
yeah,
what it is, right?
this was not to be too British centric about this, but some of the revelations of the aide Dominic Cummings. I have to be very careful. There's a very good epidemiologist called Derek Cummings, and I always mix them up. He made a comment that the country needed a big chickenpox party, or someone said that, he didn't. And that illustrates something really key here. Chickenpox is much milder in kids than it is if people get it when they're older. Right. But when people in the 70s had these chickenpox parties in which they were encouraging kids to become infected, that was in a context in which the older cohort was immune. And so they were protected. Once you have that older cohort protected, then the situation changes. But at the moment, you know, for the last 18 months until the vaccines came along, and the vaccines are yet to come along to a lot of places, you have a huge number of vulnerable, unimmunized people. And transmission can, you know, allowing the virus to transmit in the way that we have poses a very large risk to many.
So I don't want to put you on the spot here, and you can pass, but what do you think should be happening about the schools opening up here in September?
It's a great question. I think it's fair. I think that when you say here, you've got to specify very carefully where you mean by here, because there are very different places. And I think we will know a little bit more about, we'll know more about Delta by then. If you're in a situation where very large numbers of people are vaccinated, including, you know, high schoolers, then that's a different situation. I will point out that if you have the will, it has proven over the last 6 months or so possible to have mitigation in other school settings and have very, very low rates of transmission within them. So I think that this is another illustration of the ways in which people's, the amount of resources that we bring to bear and how much we think that something matters determines what actually happens with the pandemic.
Okay, I've got a question for both of you. This came from a quote in Peter's book. He said, "An epidemiologist in power is a politician just as much as someone who may have been an actor or a soldier." First of all, would you agree with that, Bill? And then Peter, I would like to ask you what you meant by it.
I think it depends on what you mean by power, because the amount of power that, I mean, there are some epidemiologist politicians, there aren't many, but the vice president of Taiwan was Chen Jianzhen, and he stepped down in 2020, actually. He didn't seek re-election, but he's a former epidemiologist, he's an epidemiologist. Whether or not that has any impact on Taiwan's relatively good first pandemic response is not clear, because I wouldn't take an N of 1. When epidemiologists do become advisors, though, I think this is a really important thing to make clear, because lots of folks have occasionally told me that I want to make decisions for people, or that, you know, there's all kind of leading by the science and what have you verbiage. Scientific advisors are not elected officials, except in the example I just mentioned. But if you're not an elected official, your role should be to offer advice, to say, if you do this, then we think this will happen. And we can say that, and you should take a range of opinions. You should discard the ones which are outliers, because, you know, the outliers are not where you want to be resting all your hopes. Take a range of opinions, and then you make a decision on the basis of that. Obviously, people who are taking that advice they do have more power than they would if they were your average Joe or Jill, but still, they don't actually have the power to make the difference that they might wish they could. But in the proper ordering in a democracy is that those decisions should be made by elected officials, in my view.
Peter, do you want to?
I said that in the context of the Swedish case, and the question was, you know, the politicians to a person all said, "Oh, we're following the science, therefore don't bug us because we know what we're doing. We're listening to our scientists and doing what they tell us to do." And that, of course, was true only in the sense that scientists said a lot of different things, and when the day is long, you could probably find a scientific opinion of some sort or another to justify almost anything, not necessarily good science, but science of one variety or another. And in this particular case, in the Swedish case, the epidemiologists, got it into their heads that the way to approach this was not to sort of lock down and not to tell people what to do, but to let them figure it out on their own in Sweden. And they got their way, where in other countries, epidemiologists were making the same recommendations, and the politicians said, you must be mad. Of course, we're not going to do this. We're going to shut down because otherwise we're going to have massive mortality and nobody will ever trust us again. And my career's over, something to that effect. But in Sweden, they had a sort of a not very strong government, sort of coalition government, and the prime minister simply didn't want to go anywhere near this issue. So he left the chief epidemiologist in charge and let him make the decisions. And therefore my point was, even though he was an epidemiologist, in fact, he was acting like a politician because nobody was overruling him.
That's very interesting that you're specifically thinking of Sweden. Sweden gets maligned a lot. It's worth noting that Sweden didn't actually quite do nothing. They did shut down I think the 15, 16-year-olds, very last few years of education and universities, and they banned large gatherings. Obviously, it wasn't sufficient to make a big difference because of the fact that, as we all know, certainly in comparison with peer nations in the Nordic countries like Norway and Finland and Denmark, Sweden had a much, much, much worse first wave. And indeed, subsequent to that has been struggling because of the fact that the amount of immunity that was gained from that first wave was not really anything much to write home about.
Exactly. They spent their entire time desperately searching for antibodies in the greater Stockholm population to try to prove that they were actually achieving herd immunity. But let's be sort of more precise about how badly the Swedes screwed up, because they, of course, would like you to believe that, they were no worse than the Brits or the Belgians. And, that's true. Their ultimate figures are slightly better than the Belgian and the British. But these aren't the countries that we should be comparing them to, because they're not the ones that they're just not in the same epidemiological situation. Compared to Denmark, their mortality per capita was 4 times as high compared to Norway, 10 times as high. That is fairly damning, it seems to me.
We've had some questions come in actually off these ideas. One is from Jay Wilberforce, who said, what do you make of Fauci, his performance, and what do you make of all the weird fawning over him by corporate liberal media? Anybody want to?
A nice balanced question.
Well, to be honest, I think that Tony Fauci is probably a bit confused by the fawning. He's a pretty solid, no-nonsense guy who has spent his professional career working really, really hard to, I think, adopt the kind of position that I was saying earlier, where you give the advice and then, you are advising the elected officials. There are certainly some things which I think he did better than others. There was a lot of, at the start, he has been very maligned for having spoken about masks within the context, for instance, of being very concerned about mask shortages. I know there were mask shortages at hospitals around here. And at that time, people were starting to hoard them. So you have to understand that within that context. If I were to fault him, I think that he was, and faulting people in general, in fact, it would be in trying to understand that the pandemic is not going to be a single event that happens for a period of time and doesn't change. We are going to have to continue to move with it. We're going to have to, some of the advice would change over time as science became more established, and to prepare people for the idea of that. I'm not sure that he deserves that much blame for that, because I think that a lot of people were just misunderstanding that in general, but it is certainly very noticeable that this led to a lot of confusion as evidence shifted about the use of masks, about the proportion of droplet to aerosol transmission. And of course, that is all exacerbated by the emergence of variants, and the variants which genuinely do behave in an epidemiologically different way from the founder virus. So I think that overall, he's had a pretty good pandemic. I very strongly suspect that he will be very, very happy when he's not on the talk shows anymore, even if he would be quite happy to have Brad Pitt continue playing him on Saturday Night Live.
This is above my pay grade. Can I just jump in and say two things? I think we have to keep firmly in mind also the extraordinary abuse to which he was subjected by the previous administration. And I suppose the general question is, was there any public health authority out there anywhere else in the world who did any better? I happen to know from his agent that he had written his memoirs up until the last chapter as more or less the epidemic struck. So I imagine it's going to be a slightly different book than it would otherwise have been.
Good Lord, yes.
Yeah. Okay, we've had a couple of other things. One person, Dorothy Keeney, says, how do you think the state should have reacted during the pandemic?
The United States.
Mm-hmm.
Well, this is a very difficult question, and I think the first part of it is to note that the United States, as a result of the way that it is, constituted, it's a federal country. There are substantial powers when it comes to public health, which are localized within the states. And the answer to this would have to be really, really long. But to try and try and not leave you with nothing, I think that recognizing the scale of the problem and being honest about the scale of the problem early on would have been very helpful. So just speaking personally, doing very rough back of the envelope calculations in February of 2020. In fact, I think I told you yesterday, Mary, that I first wrote to a friend saying this will be a pandemic on the 28th of January, 2020. But doing very rough back of the envelope calculations, you could see that it was going to be at least as dangerous as one of the worst flu seasons that we'd had in recent memory. If not 1918-19, then certainly up there with the 1950s and 1960s flu pandemics. And so that alone is enough to be saying, hello, we need to do something and start being honest about it. You earn trust by being honest. You tell people, yes, we have a problem in New York City, as was evident. That virus is not going to remain in New York City. It's not with you in Texas or Florida at the moment, but that's because it hasn't got there yet. And you have been putting in this stay-at-home orders. That means it's not going to take off. But as soon as you relax those, it will. And just being straightforward with people around that. Then I think that the other thing Peter said that I thought was really interesting, which I completely agree with, giving people the resources to being able to handle this, giving the states the ability to deal with this really, really dreadful problem. That's something which could have been done centrally and by the federal government, and more of that would have been helpful. And finally, I want to say something which I'm staggered doesn't get any conversation about this. We've heard a lot about the essential workers who have borne the brunt of this, and it's absolutely right that we should talk about that. There have been some who have argued that they are particularly badly affected by interventions to limit viral transmission. And it's certainly true because they're unable to isolate. However, why have we had so little conversation about mandatory sick pay? Because discouraging the practice of presenteeism and enabling these people to be able to take time off work to isolate would be a really valuable thing. It would also be extremely valuable for those people at the moment struggling with vaccine access who are scared of going to get the shot because they're worried about side effects and having to take time off work and miss a paycheck. So there are all these things that we could do to make things better. But it is going to be the work of our lifetimes to keep working to make things better.
Another thing you said to me, which I thought was very poignant yesterday, I don't think you realized what you said, or maybe you did, but I thought it had enormous weight. You said, I said, why are people so resistant when the science clearly shows proof of how well they're protected by vaccination? And you said, people struggle to believe the things they don't want to believe.
Yeah.
Which actually makes me wonder if they got to make a cartoon or some fantasy show.
Well, I think that there are several points at which this is relevant. The first thing is at the start of it. when, like I said, you have this mysterious virus, people are talking about it. Some people are saying, ooh, worry about, some people are putting huge, like multiple siren emojis on social media shouting, Holy Mother of God. Others are being more measured and saying, hang on, we're collecting data on this. And still others are saying it's nothing. So people then have a smorgasbord of different things that they can choose between. And as things happen, we as humans are, there's a very interesting article or a very interesting book, which I started before the pandemic and I haven't finished, by Shoshana Zuboff about surveillance capitalism.
Oh, yes.
She talks about in that about human beings and catastrophes. And she describes how she was in her house and it was burning down. And she only just escaped with her life. But for ages, she was going, oh, I'll just get this, I'll just get this. Oh, my house can't really be burning down. Look, here I am. It's just a house. It's just a bit of a fire. And in the same way, we at the start of the pandemic were, many people found it difficult to wrap their heads around the scale of what was happening. And right now, when we're talking about ways out of it and vaccines, again, people are picking and choosing what they want to believe. They're picking things which fit into the, the wider intellectual ecosystems or belief systems that they cleave to. And it is quite hard to help people get around that. We do need to listen to them. I'm not one of these people who says we send people to re-education camps. I want to listen to people to understand more about them and then try and convince them and help them, because that's what we do in public health. We try to help.
Well, it's quite an alchemy to getting the right message and the right method, because apparently the last research I was reading, the most recent in the Atlantic, was saying people that are getting vaccinated now, either it's because of a penalty, you can't go to Hawaii unless you have it, there's some kind of penalty that's imposed, or as in France, you can't go into a restaurant unless you show you've got your vaccine certificate or a recent test. So there's a penalty involved, to me personally, that I have to think about. I'm being excluded from something. The other thing that seems to be very effective is somebody having heard from someone they know that they are okay after the vaccine. Not that the disease is bad. They're not thinking about that. They're really focused on the vaccine and they were okay with it. So I think I'll do it, which I found incredible. The science almost didn't enter into it. It was all to do with word of mouth recommendations.
Well, human beings are, there's that great book, Thinking Fast and Slow, in which Daniel Kahneman talks about how human beings make these snap judgments. We think fast, and those are heuristics, which are right often enough to have meant that, none of our ancestors died before they were able to reproduce, and they're not necessarily as good as they would be when you spend time and you actually look at it statistically. A large part of the process of studying epidemiology and statistics in general is trying to unlearn those knee-jerk responses. And I still sometimes catch myself making them, but that's what we have to try and get around. And a large part of it is listening to folks. I mean, there's only so much that numbers can do.
Well, we won't have time to answer a great question that just came in, which was someone saying, how come there hasn't been more creative ways of enticing people to get vaccinated?
I think there have been quite a few. I think that
guns, I think in one state was part of the incentive. A great combination. Yeah, I think they have tried a lot of things. But anyway, I hate to tell you, but we're running out of time. I could talk to you for another hour. This is a fascinating topic. But I do think we've learned a lot more from the discussion. I certainly have. So I wanted to thank Peter Baldwin and Bill Hannage for your input and your expertise. Very, very valuable, and for making the time. I'd like to thank everybody who listened in to this discussion, what we've learned from the first wave of the pandemic. The speakers were Professor Peter Baldwin, author and UCLA historian, and Professor Bill Hanage, epidemiologist from Harvard's Chan School of Public Health.